How can a 500 for plan unlock a Black child's potential? Imagine a school where every child feels supported and ready to succeed. That's what a 500 for plan can help create for Black children with disabilities or health conditions. These plans are designed to give students the tools they need to access education on an equal level with their classmates. They make sure that children with conditions like asthma, sickle cell disease, attention deficit hyperactivity disorder, anxiety, or vision and hearing issues get the accommodations they need. For example, a child with asthma might need extra breaks or access to medication during the school day. A student with ADHD might benefit from extended time on tests or a quiet space to work. These supports help reduce stress and allow children to focus better, making learning more comfortable and inclusive. A 500 for plan is different from an individualized education program, which is for students who need specialized instruction. Instead, a 500 for plan offers accommodations without changing the core curriculum. This is especially helpful for students whose disabilities don't significantly impact their school performance but still requiring some adjustments to thrive. Despite protections under the Rehabilitation Act of 1973, Black children are often less likely to receive 500 for plans and more often placed in special education programs. This can limit their access to flexible supports that help them succeed. That's why advocacy is so important. Parents or guardians can request evaluations by writing a formal letter to the school, including medical or psychological documentation. They should participate in the team meetings that develop the plan, making sure their child's needs are clearly understood and addressed. Understanding the difference between an individualized education program and a 500 for plan is key. An IEP is for students who need specialized instruction due to significant disabilities affecting their learning. A 500 for plan is for students who need accommodations to access the general education curriculum. Navigating these systems can be tricky, especially because of systemic biases and lack of awareness. That's why staying informed and working closely with school staff is essential. Parents should request evaluations in writing, provide supporting documents, and be active in meetings. They should also regularly check that accommodations are being implemented correctly and communicate with teachers and administrators. External advocacy groups can also offer support, especially for Black families facing challenges in the education system. Securing a 500 for plan can open doors for Black children by providing tailored supports that address their health or disability needs. These accommodations can make a real difference in reducing barriers to learning and participation. When children feel supported, they often gain confidence, perform better academically, and develop stronger social skills. Over time, this can lead to better educational outcomes and set a foundation for future success. With the right advocacy and understanding, families can help their children reach their full potential and enjoy a more equitable educational experience.